And now we're moving on to the next speaker, who is Louise Knowles, who's the Deputy Director of the Research Faculty for Infrastructure and Growth for the Department of Health and Social Science and Social Care, should I say. And she'll take up some of the discussions that come up this morning around that Lucy was speaking about. So I think if we can move on to Louise, that would be excellent. Thank you.
Thank you very much, Steve. And just check everyone I hope everyone can hear me. So thanks very much for inviting me along today. Yes, I'm going to give a bit of a conversation about the new chapter for CRF. So first slide. Yes, so that's my introduction. Can I get the next slide, please? So yes, so just going to give a bit here, probably building on what Lucy said to you this morning, a bit around best research for best health, the next chapter, and also touching on that in terms of what that actually means for clinical research facilities for the NIHR. Next slide, please. So best research for health, yes, the introduction. Title page, can I go to the next slide? Sorry, I seem to have quite a lot of slides. So just to set the scene for everyone, to remind everybody, for those of you who maybe don't recall, where we've got to and where we started. So started back in 2006 when the NIHR was established under the government's strategy, Best Research for Best Health. Really, which has really set the course for NIHR, creating this kind of idea of a health research system in which the NHS is supported with outstanding researchers working in these kind of world-class facilities and conducting kind of leading research focused on the needs of patients and the public. We had a few years ago, we had our kind of 10-year anniversary, and kind of really showed some of the fantastic impact that we'd had across NIHR over those 10 years. And things have continued to build over the 5 years following that, and our remit has continued to grow. So as well as doing all the work that we were set up to do originally, we've also now got kind of significant work in kind of global health. We're doing much more work in the kind of social care and the focus around social care and public health. So a big shift in our focus alongside how the Department of Health, now called the Department of Health and Social Care's focus has shifted as well. So there's various things that we're looking at doing, and Best Research for Best Health, which was published earlier this year, really sort of set out where we've got to, but also where we need to go. Really looking at kind of the core work streams and the areas that we support and will continue to support, but where we could still make some improvements. But also talking about several areas where we have some strategic focus and where we really want to deliver some transformative change. So, and I will talk through some of those in a bit more detail. And that's really, all those kind of areas of focus are really going to underpin some of the kind of real forward-looking strategy that we're looking to take forward and publish, and we'll be hopefully publishing at a later date. I think just to say that the intention of sort of Best Research for Best Health was really about reflecting how the system has changed and is changing, so we can really kind of think about how we make sure the NIHR is best placed in terms of our priorities and our work streams to deliver on that. So next slide, please. So to our core work streams. So just to run through very quickly. So yeah, next slide. Thank you very much. So these are our core work streams. They're pretty set and have been for a number of years. But to remind you what these are, so the first of these, funding high quality, timely research, really about how we support the research funded through our NIHR programs, and making sure that is fit for purpose, and those are answering the questions that the health and care system need, making sure that we have funding available to both the public and private sector to access our funding, but also making sure that we have a kind of model to avoid waste in research and achieve that kind of maximum impact in terms of the research that we fund, but also that it's answering the most important questions. The next one is really where the CRFs are really central to, around how we invest in world-class expertise, facilities, and our skilled delivery workforce. So, as I'm sure many of you will know, since the establishment of NIHR, we've really provided that kind of, the idea of providing sustained investment in expertise, facilities, and our workforce and the support services, the infrastructure, as we call it, across that innovation pathway. So that's really about making sure we have that capacity and critical mass in the system to support the research that we fund in the NIHR, but also underpinning the research funded by others, whether that be people like UKRI, the medical research charities, the life science industry, or any other industries or other groups. And it's really important because it's that infrastructure that really why people working in the life science sector choose to access the expertise that we have in this country around designing, setting up and delivering that high quality innovative research. So we offer that support to multinational companies, encouraging them to come to the UK. We use that support to help grow our own UK-based industries, particularly SMEs, but also allowing researchers, patients, and the public to get access to that infrastructure and giving kind of people opportunities to participate in research and get access to potential new treatments. So going forward, there's obviously a continued push to keep investing in this infrastructure, looking at how we kind of do more about integrating research delivery into kind of real world health and social care settings. How do we reduce the barriers across the NHS and across the health care system for allowing more people to be participating and contributing to research? How we look at the use of things like more flexible workforce models, innovative delivery models to make it easier for people to undertake research, and also for people from more diverse communities to participate in research, bringing it closer to where they are and what that means to them. And of course, other things around building capacity to help innovators build the evidence they need to help develop and evaluate their new devices or their new innovations. And really importantly, and I think an area where I think the CRFs through the CRF network are really kind of leading the way, is that kind of piece around collaboration across the infrastructure to really sort of drive progress in priority areas and create those opportunities to build capacity across the system, which is really obviously important. The third of the core work streams is partnering patients and the public. So again, as you would expect from NIHR, I hope the continued emphasis on collaboration with patients, service users, carers and the public. Again, obviously this is core to the work of CRFs as it is for all of our infrastructure. And some of the things that we are particularly committed to is in creating that kind of diverse and inclusive research environment founded on the kind of principles of equitable partnerships, making it easy to participate in research, as well as looking at things like how we collaborate and co-produce research, and also how we use things such as digital approaches in a more kind of user-friendly way. The next is around attracting and retaining the best researchers. So I'm sure you probably know NIHR is the nation's largest funder of health and social care research training. So developing career pathways for clinical academics. We're also, as I'm just following Ruth, talking about what the new opportunities could be for things like people in the nursing, midwife professions, as well as allied health professions, to integrate research more as part of what they do in terms of their clinical practice. So that's about how do we develop new networks, new partnerships, new structures to attract and develop in underrepresented groups and underrepresented sectors. So again, Ruth just spoke about places like primary care, community care, social care, public health, but also other groups, nurses, pharmacists, social scientists. It's also about thinking about what additional capacity do we need. So disciplines, we talk about data science, bioinformatics, statistics, health economics, machine learning, to ensure that our research workforce is really professionally supported with dealing with those opportunities and challenges associated with data. And of course, that's also really important when we're talking about the delivery of clinical studies, clinical trials, and the kind of want to move to much more digitally enabled trials. And how do we ensure our workforce is ready to work with that? Obviously, working very much with other funders and other groups to make sure research careers are attractive to a broad range of people. But of course, it's not, NIHR aren't the only game in town here, but also about how do we do more to address some of those traditional barriers for career progression. So obviously that came up previously as I just listened in around the nursing side, but there's obviously particular challenges in clinical academia in later stage careers for women who often don't progress beyond the postdoctoral stage. Those from other underrepresented professions, ethnic minorities. We also need to do lots of work supporting new medical schools, expanding how we can support mentorship, and also looking at how can we kind of really kind of think about what do we need to do across the whole area, as well as areas that are a big focus for, particularly for government, around innovation and growth in the life sciences industry, and working with other charities to provide researchers and people working in research with more new skills and experiences and opportunities, maybe outside of the NHS or outside of the health and care system. The other areas are collaborating with others, so working with partners across the kind of funding landscape, working closely with people like UKRI, of course, our colleagues in the medical research charity sector, about how we actually create that really integrated research system. But also, of course, the opportunities for building on our long-standing relationships with our regulators. So, as I know, CRFs, you work very closely with colleagues in MHRA and, of course, HRA. And how do we really work with them to kind of accelerate and adapt research processes, as we did for COVID-19, and how do we take that forward into the next stage of our strategy? And of course, there are new bodies responsible for in this space, particularly people like NHSX, who are looking at kind of digital technology and data science. So we have to build those relationships and think about how we're going to work together to collaborate to deliver the kind of real change that we want to see, particularly around the delivery of clinical research. And then, of course, finally, our global health research portfolio, so that we're looking to continue to grow that, looking forward to trying to strengthen the work we do with LMICs and the consortia to address sort of health challenges, both in LMIC countries, but also how we can take some of that learning back into the UK. Next slide, please. So all of this work is underpinned by 5 operating principles which shape and reflect what we do. So we talk about impact. So how we prioritise the challenges that are most important, and how we sort of accelerate that translation to make sure that the evidence that we generate through the work we support in NIHR actually is used to improve everyday practice. Excellence, so quality of our researchers, outputs and training is world leading. We've got that kind of highly skilled research design and delivery workforce to underpin all of that. Inclusion, so we're committed very much to equality, diversity and inclusion in everything we do. Working with diverse people to shape our careers and our research, but also to make sure that we work with kind of a broad range of researchers from multiple disciplines, specialisms, geographies, backgrounds, and really kind of look at all of the challenges around that. Collaboration, of course, I've kind of touched on that, but absolutely key to what we do across the NHS, the social care system, people, communities, government, universities, colleagues in the devolved administrations, industry and charities, etc. And finally, effectiveness. So NIHR being a publicly funded organisation, we have to ensure that we can ensure that what the funding that we give out is used effectively and efficiently, and generating the evidence that really enables the health and social care system to be more effective, and that we seek to continuously improve what we're doing. Next slide, please. Then we move just quickly to ways of working. So these are areas where we kind of want to improve our ways of working, so making it much easier for people to understand what NIHR does and how they can work with us, and how they can use our evidence to evaluate our impact. So we in NIHR are really committed to strengthening our communications to engage and involve stakeholders in the work of NIHR. To support how we disseminate our research findings, but also the value of the work that we do in NIHR more broadly. And I think there's a role for every single one of us in NIHR to do that, and absolutely the CRFs as a part of that NIHR family would see really key in kind of pushing that agenda. Collaboration is really key, and we want to ensure that we continue to work with others, harmonising research processes, reducing the unnecessary bureaucracy, but making sure that we can be transparent and accountable for the money that we use. And of course, ensuring that we are improving how we use our evidence in terms of how it can make an impact on the health and wealth of the nation. So how do we actually see what outcomes the research is generating, how we look at progress, and how we know if we're achieving what we're trying to achieve, and so we can adjust course if necessary. Next slide, please. So now onto our areas of strategic focus, which are the areas really for the future. So the first of these is building on learnings from the COVID-19 response. So many of you that will be here today have been involved either directly or tangentially in COVID-19 and the work that we've done there. Obviously, as I'm sure many of you said, in the words of Helen Campbell, we played a blinder on in COVID-19 in this country, and that's in no small part down to the support people at this event today. It was absolutely key in providing us with absolutely crucial evidence to strengthen that we needed to address the issues around COVID-19, and we need to kind of think about how we use the lessons we learned there in terms of strengthening our abilities to fund and support research, but also about how we think about the preparedness for the future and potential for future pandemics. Obviously, as I say, CRFs absolutely fantastic at the absolute hub of all of this in terms of creating that kind of joint model coordinating responses and that integrated delivery of COVID studies. And we need to think about how CRFs that you sort of look to cement those connections going forward. From our side, we need to be thinking about how we prepare for pandemics, that kind of whole research system alignment piece to really be ready to respond if needed. How do we kind of make use of some of the kind of things that we saw around? People talk about platform studies and platform trials, but also other sorts of approaches to really rapidly evaluate the effectiveness of different interventions to tackle new diseases. We obviously also have things like emerging organisations like the UK Health Security Agency that we need to think about how we work with them. And also we need to make sure that we continually work with our colleagues in the health service to think about how do we continue to support their recovery, to deal with the backlogs, to deal in areas such as how do we look to improve diagnosis, etc., to keep improving that. I think I'm running out of time. And then, of course, there's all the lessons learned stuff that we're doing, taking forward, particularly through the recovery, resilience and growth piece of work. Next slide, please. The next one is where we're going to build more capacity. So we're talking about building up capacity here, stronger evidence bases in fields which have been historically underserved. So preventative public health and social care research, particularly working with local authorities and third sector organisations working in social care. So that's an area of real focus, widening the excellence in areas such as mental health as well, and funding for dementia research. So building capacity in those undisturbed areas. Next slide, please. Improving the lives of people with multiple long-term conditions. As we know, it's an increasing burden across the country, and those are only going up. So we've already published our strategic framework for multiple long-term condition research, which sets out our priority aims and the pathways to foster changes. But I think for clinical research in particular, it's really thinking more about how do we account for people with multiple long-term conditions in study design and recruitment, and not excluding them from the work we're doing. So again, something for CRFs, I think, to think about as part of the next steps. Next slide, please. Bringing clinical and applied research to underserved regions and communities. So we know that obviously lots of early translational research where you're working, it makes sense for it to be concentrated in the centres of excellence. But it is important more broadly for more clinical research and applied research to be taking place in the regions and communities with the greatest health and care needs. We're talking about things like coastal towns, rural areas, semi-rural areas, those with ageing populations. So what we need to be thinking about now at CHAR is how do we do more to serve those people? How do we encourage more people and more researchers to be actually delivering research in those underserved regions, building capacities, capabilities in those areas that maybe haven't traditionally been very research active, and nurturing these new kind of NHS and non-NHS research site interactions to ensure that you can actually build capacity in those areas. Next slide, please. And then finally, embedding, I won't cover this one, I have covered it already, embedding equality, diversity, inclusion across all of the NIHR's research systems and culture, not just in terms of how we organise ourselves, in terms of how we fund our committees, how we do peer review, also ensuring that our researchers thinking about equality and diversity inclusion, how they design and deliver studies, but also about how they also embed that kind of positive research culture across everything they do. And again, that would be true for CRFs, for all the NIHR family. How do you think about equality, diversity, inclusion in your PPI activity? How do you think about the culture within your organisations for those working in your organisations? And of course, how do you ensure that the work that you're delivering really takes account of those differences? Next slide. I probably won't talk about this too much. We've talked about this a bit, but strengthening careers for research delivery staff and underrepresented disciplines. So there's a lot in there around clinical academic pathways, but again, I won't repeat too much what I think Ruth said, that we've got a real commitment to think about what we can do to strengthen careers for staff, particularly in the nurses, midwife and allied health professional area. Obviously, the new CRF competition has got that kind of increased new remit to support the development of highly skilled research delivery workforce for early translational and experimental medicine studies. So we're looking to really strengthen how the CRFs can support those development opportunities for those who work in research and deliver research. That kind of idea of providing theoretical, practical training, considering how you provide support across the pathway for all different levels, and how you build that capacity and expertise within the CRFs. Next one. Expanding work with the life science industry. Again, obviously, as many of you already know, I don't need to tell you this, the life science industry is crucial to the UK's economy. Huge turnover in this country, 81 billion of turnover, employing over a quarter of a million people in this country. So what we're doing is, again, COVID really demonstrated what we can do, and there's lots of work that we're doing to really strengthen that through the work that's been taken via the life sciences vision, and as part of that, the vision for the future of UK clinical research delivery. And that's really focused on how do we expand our engagement with the industry, developing much more one NIHR offers to companies of all sizes to engage with us, whether they're coming to us to do their kind of their early phase work and how we support them all the way through that system, or in whatever way that they need to. We need to think about different types of industries in life sciences, so digital industries being a key one, biotech industries being another one that we don't necessarily work with that much. How do we also think about our infrastructure to support those kind of homegrown companies that need to kind of have access to our expertise, and also often don't know where to go? And how do we do that in partnership? How do we do that in partnership with colleagues across government, with universities, with parts of the NHS as well? So we will be working hopefully closely with many of you around the table and people that you work with, particularly on how we realise our vision for the future of clinical research delivery. We've also lots of work in the areas around the life sciences vision, focusing on around things like health innovation, the health missions, as well as various areas around kind of innovation. And of course, how we look to expand how we work with the industry, not just talking about the kind of global pharmaceuticals, but also the kind of biotech industries, the diagnostics, the medtech, digital systems, people in artificial intelligence, where there are real opportunities for the UK. Next slide, please. And this is just a final slide, almost final slide for me, just to highlight what a fantastic year it was last year. So this is just some highlights from your annual reports to give us an overview of what activity you guys were doing. So nearly 5,000 studies reported, 347 of those first in human, over 123,000 people recruited to studies supported by the CRFs. Loads of partnerships with SMEs, 84 new strategic partnerships, 144 million leveraged across the CRF. So I just wanted to say, fantastic. I mean, obviously, last year was a difficult one, I think, for everyone, but I just think that just in numbers shows just the volume and the fantastic work that the CRFs are doing. Last slide, please. And just to say again, thank you. So as I'm sure you guys realise, the CRFs really are a vital part of, crucial part of our NIHR infrastructure, and have been from the start. And we're really looking forward to continue to work with you in carrying on and building on all the successes that you guys have shown and demonstrated over the last year and even before that, and building on those as we sort of take the NIHR into the next chapter. Thank you.
Thank you, Louise, for that Whistle stop tour through quite a lot there, strategy. Most of us have read the documents, but it has been really helpful for us as a community to see how we align as clinical research facilities to make sure that we're benchmarking ourselves against the strategic direction and the vision for research in the UK across all the nations. The question then really is an obvious one, and there's a lot to be focused on there. So, what will the focus be in the next year and the years to follow? What's the sort of plan to deliver this?
Yeah, it's difficult to say. So I think for us, I think it's particularly on the clinical research side. We'll be focusing very much on the next stage of the clinical research delivery vision. So many of you, I'm sure, have seen that and the work that we've been doing this year to try and focus on what can we do to start create that baseline which we can build from. So in the next year, we will be looking to publish the second phase of that and working with colleagues, I hope, to inform that.
Yeah.
And I think that's really going to have to focus on a couple of things: is how do we improve the speed and efficiency of clinical research? How do we build the data systems to enable that to happen? And how do we also help to recover the pre-COVID portfolio and provide some release in terms of the capacity that we know there's a need for more capacity in the system. So we need to think very carefully about how do we help support and grow that. But underpinned by more digital enablers to hopefully relieve the burden on individuals, I think is going to be the real focus for next year.
I think I'd be very welcomed by all of us because I mean there is quite a legacy of the COVID work that's still carrying on. So really important that we, get restart activity going as well, but recognize, as a fixed system, there, fixed amount of people, how we build capacity and some innovation is really will definitely be welcomed. So the second question I was from the audience is really around what are the plans? What plans are there to support the CRFs and other infrastructure to collaborate more with the life sciences industry in a clear way?
Yeah, so I think that's an ongoing piece of work. So obviously we do provide some central support across NIHR through people like NotCRE, etc., in terms of collaborating life sciences. What I think we need to do now is work onto the next stage, is how we then roll that in with the work that we do, say, NotCRE, supported by the Clinical Research Network, and in partnership with some of our colleagues in places like MHRA, who now have the ILAP program and other programs, to really think about how can we offer a strategic, almost end-to-end offer to industry, of which CRFs are a part, and an important part, but it provides that piece. I don't think we're quite there yet. I'd also say that obviously, given that it's still in live CRF competition, I'm hoping that there'll be some further things we can talk about in the future once we know the announcement, once we've announced the outcome of that in terms of who will be designated, about what that might mean in terms of what additional support the NIHR can provide in really pushing the CRFs as part of the UK's offer to industry and SMEs for the conduct of early phase research.
Yeah, and we have some successes in that recently. I'll give a shout out to my friend and colleague Paul Brown here, who leads in our industry group, industry theme within the UKCRF Network. He's driven quite a lot of work over the last couple of years to filter out the expressions of interest and make sure we're signposting industry to the right CRFs that'll have the capacity or the capability to do some of these early phase trials. So I think that's been very, very helpful, and I'm sure that'll build in time. And the final question I was going to ask you really was, I think a lot of us are very excited about the preventative public health and social care research, much of it developed and driven within the community. How do you see the CRFs helping with this?
Yeah, it's an interesting one. I think if you take those three separately, I think in some ways preventative is probably easier. And I think we will see over the next few years more of a focus less around treatments, but more around treatments to be preventative. So we know about, many of you will know, like the Gallieri study that's starting and those sorts of things, and the trials around things like inclisiran, etc. So I think some of that stuff I think will come through. On public health and social care research, at the moment, I don't know exactly what the CRFs, given their very specific and expertise role, will have in that space. But having said that, I'm not an expert in neither public health nor social care research, and I know that they're quite different factors of research. But I think there could be some really interesting things in thinking about how the reach of CRFs and particularly the expertise within CRFs to do very complex, innovative studies, and how do we share some of that expertise with a broader range of researchers and research delivery teams. Perhaps that they may be able to take some of this learning into some of their other areas of research. But I think that's an open question and one I'm very happy to come back to in further discussions with colleagues in CRFs.
You've shielded that one very nicely, because that's would have been the right answer, really. The public health, I mean, this is one of the observations really of this last year and a half, is that there's been a public health emergency, but we don't really have a network of public health research staff, you know, that are universal across the UK. So, you know, it's that collaboration that's driven the success, and actually learning from those that you know that have transferable skills and knowledge is a really key element for us as a community. So it just falls now on me just to say thank you very much for making the time and effort to come along, and also for answering our questions. I'm sure that we'll be in touch in future as well, and just on behalf of the organising committee, just to thank you again for your input to making today a successful conference for us. So I think we can let you go away with that. Okay.
Thanks very much, Steve. Thank you very much.
You're welcome. Thank you. Nice seeing you again, Louise.